focus on arts and health is not to become the perfect actor or give the perfect dance performance. It's about using the arts as self-expression and coping mechanisms with self-efficacy to really help us, empower ourselves with some coping skills, dealing through mild and minor mental health challenges and whatnot. And again, speaking on research and studies, there's been studies shown that integrating arts and health into our daily lives can benefit our health outcomes and well-being on the physical, social, and mental levels too. And I definitely also want to acknowledge, though, that traditionally, this is not something that is new to us. Like you've said, it's very innate, right? So really acknowledging the many artists, culture bearers, creative workers that have been serving as health and well-being practitioners for generations, right? Across different cultures too. And so while we understand this conversation as being relatively new, it's really been around for a long time. And these practices have been deeply rooted across the world in very different diverse populations too. So, and it was a way of life for our ancestors, right?
Hey friends, welcome to Public Health Careers. I'm Omari Richins, founder of the Public Health Millennial. Every other week, I interview leaders and practitioners across public health, sharing their expertise, lived experiences, and the strategies that can move you and your career forward. Today's guest is Jennifer Kuo. Jennifer is an arts and public health professional and educator based in the Los Angeles area. With over 20 years of experience spanning health and wellness, education, marketing, and community engagement, Jennifer is a dynamic leader in the field of arts and health, from managing program logistics and evaluation to teaching yoga and music to children. Her career reflects the transformative power of creativity in health and public health. She earned her Bachelor's of Arts in Marketing and Music Industry Studies from San Francisco State University, followed by her Master of Public Health in Community Health Education at California State University, Northridge. In today's episode, you'll hear and learn more about the importance of the connections of art and public health, how her early interest in music and marketing shaped her thinking about health communications and engagement, why she believes arts participation should be recognized as a social determinant of health, why arts needs to be better integrated into the education and the practice of public health, why the future of creative health lies in empowering community organizations and community movements, how self-care and healthy habits are essential for public health professionals, why it's important to take a risk and create unique educational paths like the one Jennifer did with her arts and public health path, and much, much more. Be sure to hit that like button, hit that subscribe button, and enjoy today's episode.
Hi, this is Jennifer Kuo. I am an arts and public health professional, and you are listening to the Public Health Careers.
Jennifer, I'm super excited to have you on today. Welcome to the show.
Thank you.
Yeah, definitely looking forward to jumping into some of like the arts and health. I feel like it's a conversation that has been coming up more often, and I think it's an important part and aspect that we oftentimes miss or overlook. So looking forward to some of that.
Yes.
So to get things started, how do you identify and tell us a little about your personal background?
Sure. So a little bit about me. I was born and raised in Southern California, and I identify as an Asian American woman, and I use the she series pronouns. I am located in the Los Angeles area, and I've always had a deep appreciation for California's vibrant multicultural arts landscape and its profound impact on community health and well-being. And so some fun facts about me: my favorite ways to relieve stress and find joy include dance and yoga, engaging with music, whether it be attending concerts or even being in a karaoke league. Yes, that's the thing. And practicing mindfulness by immersing myself in nature and meditation. And I really believe that we hold our issues in our tissues. So movement plus music is medicine.
Love all of that. So tell me more about the karaoke league before we get into more professional things.
Yeah, so it is a national thing. Again, I'm based in LA, so there was a LA one. So just as you have like a social basketball league or social bowling league, There's a thing where every, week, once a week, people gather in a local bar, so supporting local businesses. There are usually about 6 teams. You have your own team name. There are solo and group competitions, and you don't have to be the greatest singer to win. It's all about song selection and audience engagement. So there's like props involved, themes of the week, choreography, run to choreography, and all you have to do is engage an audience, and they vote on the website for their favorite team and performer, and that's how you kind of climb up the ladder. Again, it's friendly competition, a good way to relax. So I would say if you're interested, just Google, the city you're in and look up Karaoke League, and I'm sure there's one near you.
That's awesome. I've never heard of that, but that sounds like a great way to I guess like release, relieve, and like
Exactly.
have fun.
Yeah.
Awesome. All right, now shifting a little bit more professionally now. So in your work, as I alluded to, you do a lot of work in arts and health, and you're the Arts and Health Initiative Consultant for California for the Arts. So how did you come across that, and what do you do?
Yeah, so California for the Arts is a statewide advocacy nonprofit org. This opportunity actually came to me through networking. So a few years ago, I was at a arts and health related convening at an event, and I briefly met the CEO at the event afterwards. And when they wanted to start building their arts and health initiative as another program under their umbrella, and they kind of knew about me and about my work, and they followed through some of, on social. And there's some conversations, the opportunity aligned for me to start working with them at a consulting basis. So what I do is I focus on outreach strategies for educational and advocacy engagement, such as producing webinar series, creating toolkits and policy briefs, and conceptualizing potential pilot programs. I also manage the Captain Core program for Arts Advocacy Day by coordinating arts and culture leaders and meeting with lawmakers for the state. So in April, we always go up to the Capitol in Sacramento, and we arrange meetings with about 120 lawmakers to talk about policy priorities focused on arts and culture.
That's awesome. That's awesome. That's a lot of cool work. And I feel like not something that you typically hear someone with like a public health background getting into. So maybe how did that, and I know we'll talk more about your journey into that, but like how did that like happen briefly? Is it that you always did arts and health as a part of like your work and schooling?
Yeah, so I think my journey and what inspired me into this intersection is music and dance has always been a part of my life, but I've never aspired to be like a concert pianist or like a professional dancer. I just really enjoyed how music and dance made me feel. So as a child, I didn't know like about serotonin or cortisol, right? I just knew that dance and music lifted my mood and eased my anxiety. So I think when people look at my resume, it's very scattered at first glance. It's like, like I didn't know what I was doing. And there were a lot of times where I would question myself, like, what am I doing, right? With this modge podge of different things on my resume. And my experiences really range from, various roles over the past 20 years, everything from health and wellness to community engagement, education, marketing, event program planning, and for different entities like corporations, nonprofits, and the public sector. So, but I really realized that there's always been a clear through line that's guided my work. And that's really a passion for supporting health and well-being, nurturing creativity, and creating positive social impact in some way. So now looking back, the dots kind of connect in a way that kind of now makes sense. So really shaped on my personal and professional experiences. I've been deeply driven by a curiosity to learn about how we can advance the intersection of arts and health. So I would say the past 5 years or so now, I've been focusing on this field through education, research, and practice, really stemming from all of my different, work experiences and transferable skills. And I really believe that in a world where health and well-being, extend beyond just medicine, that the arts are a transformative force in public health.
I agree with that. You mentioned something specific. You conceptualize like pilot programs. What does that look like?
Yes, very interesting in what's happening in the US now. So, on the global level, there is a concept called social prescribing, and it's a framework that's really been gaining traction. I'll first kind of read you the international definition and kind of talk about what it is. But this is also how I see how the creative health field is evolving globally and nationally. So, the definition is social prescribing is a means for trusted individuals in clinical and community settings to identify that a person has non medical health related social needs and to connect them to non clinical support and services within the community. And the keyword is by co producing a social prescription, which is a non medical prescription to improve health and well being and strengthen community connections. And this concept of social prescribing originated in the UK decades ago. And it's now in about 31 countries with high visibility in the UK, Canada, Australia, with growing momentum here in the US. And England was the first country to implement this into their healthcare system. And since it's been made in 2019, it's benefited over 2 million people over there. So what that looks like here, I'll give you some examples of being in the US, is many pilot programs now in the US are being implemented by hospitals, colleges, community organizations, really focus on varying populations from like the youth to the incarcerated, urban to rural areas, and addressing different health topics like the aging, social connection, mental health. And in some states, there are also even programs that involve healthcare insurers providing reimbursements or cost coverage. So really, if we imagine how we can empower people to take better care of their own well-being, that, with social prescriptions, hopefully it can prevent them from getting sick or getting chronic conditions and diseases. So this will also allow healthcare professionals to really focus on people that really need the serious, medical care, and hopefully it also relieves, healthcare worker burnout. And ultimately, hopefully, it reduces medical costs all around. So, in a sense, pilot programs that I'm working on is really how do we bridge those gaps and make it very cyclical and interagency related, really for prevention, so that folks can focus on, what's really needed in terms of intervention, and just make a better cohesive system and more empowering for people and individuals at the community levels.
I love that. I haven't heard the term social prescribing before, and I'm definitely going to look more into it. But it definitely like makes sense, and I think about it. This might be like a small example of it, like how you go to a doctor's office now, they're asking you like social determinants of health questions
Yeah.
to kind of like target those things. And I think like to your point, it is how do we understand those and then create a space where we are working on those prevention services so that doctors are only operating at like the top of their scope and not burdened maybe with I don't know if that's the right word, but burdened with like the other things that maybe someone else is better positioned to support.
Yeah, and definitely when you're talking about the social determinants of health, it's really looking at how do we make that change at the policy level. So my vision is really on how do we include in terms of arts participation within health policy. So how do we position access to arts and culture opportunities as a health indicator and a health promoting behavior? So recognizing it as one of the social determinants or social drivers of health. And we know that to be, the five factors, right? We access to education, quality education, and quality healthcare, economic stability, built environment, and then fostering social and community context. So how do we get the access to arts and culture activities as one of those drivers? This inclusion can strengthen health promotions and prevention efforts too. So it will not only enhance individual community well-being, but really empower people and social like CBOs to really play a part as a essential factor of public health. And even drilling down more, I know we've probably all seen that graphic of the person and then the percentages of breakdown of what makes up their health.
Mm-hmm.
You know, talking about the
Yeah.
graphic. Yeah. So we know that, in public health, and for those that don't know, health encompasses just more than just, our person, right? It's also about the zip codes they live in, right? And all the different factors around them of where they study, where they work, and where they play. And then we know studies have shown, 40% of our health is really based on, SES, social economical, status, such as education, income, and our job opportunities. 10%, is based about our physical environment. So our housing, air quality, green spaces. 20% is really about individuals' health in terms of their access to healthcare and the quality of care they receive. And then 30% is what I'm really interested in. It's the overall health outcomes are determined by our individual health behavior, right? Such as physical activity, nutrition, lifestyle choices. And that's basically what people have been telling us, doctors and teachers, our parents, like, you have to eat better, exercise, blah, blah, blah. And these factors are basically things that we have more control, hopefully, as individuals. So then if the access to arts and culture opportunities are more readily available into our ecosystem, it could encourage people to engage in these activities even more. So how do we, seamlessly integrate them into our everyday lives and lifestyle? And so a lot of what I'm working on and learning about are projects that are helping to advance these efforts. Because as you know, again, we've been told physical activity, nutrition are good for our health. We also have to know that this includes the arts and culture and how they are helpful for our health too. And again, this can be anything by receptive engagement, like just listening to music, watching performances, or, very active engagement, such as going to a dance class, going to a ceramics class, attending drum circles or painting classes too.
Yeah, what I appreciate about this, I think, is like the expanding conversation on like health. I feel like even in more recent years, people wouldn't think of like community as like a big component of health, but now we're seeing isolation and like what that's causing. And I don't even think we are seeing like the full impacts of that yet. But
Right.
also like bridging that even further, like arts and health, and like how do we think about all these different components that are inherently around us, human, and we experience in ways. So I appreciate you like raising that up, and that's some really interesting and cool work that you're doing.
Yeah, thank you.
What do you do on a day-to-day basis?
Oh gosh, day-to-day basis, I would say it really fluctuates by the week, based on the projects I'm working on. A lot of just remote work, so a lot of computer time, meetings, phone calls, virtual phone calls, a lot of writing, a lot of reading. I'm based on the West Coast time. A lot of folks I'm interacting with on an East Coast time. So really it's on a day-to-day, fluctuating between project priorities and whatnot. And I also try to be mindful and, practice what we preach, right, is to really carve out that time to engage in arts and culture and wellness activities to, refuel and recharge. So ultimately it's a, peaks and flows and ebbs and flows, peaks and valleys on a day-to-day basis.
And what kind of experiences or skills are like most important or you use mostly in the role that you do?
Wow. Again, going back to like my work experiences is really looking at transferable skills. I think whatever we do in terms of our job titles or roles, it's really a good practice to practice time management as best we can, priorities. I think also just listening and observing is a really good skill because I'm a lifelong learner. And I feel like anytime I get a chance to listen in on conference calls or, virtual symposiums, it's always beneficial to really be observant, listen. And then on the flip side, really be curious and ask questions. I think we really have to lean into each other and learn from each other's experiences and expertise. And so a lot of the skills are like interpersonal, and then developing hard and soft skills too as well.
What do you enjoy most and what's most challenging in your role?
So currently, I would say the role I enjoy the most is being able to create different educational materials that are helping people to learn about this intersection of arts and health and what that means. So really connecting communities together, connecting expertise together, and really raising awareness. And also really ultimately hearing about how the arts have impacted people's lives. So people sharing stories about how the arts have helped them personally, professionally, and then, why they are also getting into this work as well. And I would say the most challenging thing right now is, especially in this role, given the landscape we are all in right now on the federal level, I'm really learning a lot about policy work and advocacy and what that really means. Again, because my background, I did not study poli-sci and whatnot. It's just learning on a very layman's, terms, advocacy, grassroots level. Again, because of what's happening at the federal level, I'm really seeing that the challenge is to how do we lean in on the local and state levels, right? Like high in the sky is we want these programs to be implemented from the top down, but because of all these cuts and different changes and complexities, how do we now lean in now on our local and city governments to really go from the bottom up and doing little pilot programs, right? Like really making an impact in small ways so that ultimately we're preparing ourselves for that when we get to a federal funnel that we have, this case making already in place.
Yeah, I'm glad to see that there's still like momentum and people thinking about like how do we continue to do this work despite the federal challenges and to your point, like even like build a case to for whatever is next to be positioned as like this is something that's important, this is something that community partners and community care about, and I think that is exactly what we need to continue to do, build it up from the ground.
For sure.
So why do you believe arts should be integrated into public health practice?
Why do I believe art should be integrated into public health? Kind of ties into a previous answer, but I really seen firsthand how arts can foster social connection, healing, and resilience. And there is evidence-based research showing how the integration can improve health outcomes too. And the focus, again, is not on engaging in the process. It's more engaging in the process of art making and not so much on the final product, right? So again, I'll say it again, the focus on arts and health is not to become the perfect actor or give the perfect dance performance. It's about using the arts as self-expression and coping mechanisms with self-efficacy to really help us, empower ourselves with some coping skills if we're dealing through, mild and minor, mental health challenges and whatnot. And again, speaking on research and studies, there's been studies shown that integrating arts and health into our daily lives can benefit our health outcomes and well-being on the physical, social, and mental levels too. And I definitely also want to acknowledge, though, that traditionally, this is not something that is new to us. Like you've said, it's very innate, right? So really acknowledging the many artists, culture bearers, creative workers that have been serving as health and well-being practitioners for generations, right? Across different cultures too. And so while we understand this conversation as being, relatively new, it's really been around for a long time. And these practices have been deeply rooted across the world in very different diverse populations too. So, and it was a way of life for our ancestors, right? Everything from like nonverbal communication through dance or passing down oral history through cave paintings, right? So it's also not to diminish the advancements of medicine, right, and medical technology. Like kudos to that because it's really benefited humanity overall. And I also want to invite reflection how we can create a more balanced integration between these two innovations, along with the holistic, traditional approaches. So again, this is not a new concept we're talking about. Like social prescribing is not new. Practicing enjoying arts and culture is not new. Instead, we have to think of a way of how do we incorporate these practices back into our healthcare and public health systems as a powerful tool to enhance our well-being.
And how are you seeing the field of creative health evolve globally or nationally?
Yes. So globally, I mentioned is a social prescribing framework.
Mm-hmm.
And then nationally is some of those smaller pilot programs we're looking at. And I know it's because our systems are still different between the US and UK. It's a lot more complex on our payer system in terms of healthcare. So I think right now what we're looking at on national level is how do we really empower community-based organizations, nonprofits, arts and culture institutions to really develop pilot programs without trying to integrate and infiltrate healthcare systems so much yet, really building upon measurement and evaluation with the local level. So again, it's a growing field nationally, and so there's a lot of people interested and trying to curate their own pilot programs too.
And what's your vision for how public health systems, hospitals can embrace arts more intentionally?
Yeah, so alongside trying to advance arts and culture opportunities into, the SDOH, and also trying to make it more of a health indicator, it's really a cyclical system that I envision it to be. So again, like you said, a lot of doctors, they are already overwhelmed, right? They are very focused on fixing people and treating people. So how do we rely more on public health professionals and workers on prevention? So one way I see this happening is there's a few programs in the U.S. that are kind of simulating this concept, but is how do we get arts and culture workers and artists to be seen as health workers with health aligned goals? So for example, there's the world of arts education where people are learning technical skills, right, on how to perfect their craft, which is important. And, because it might be selling their artwork in museums, galleries, open air markets. And they're also teaching folks how to learn proper techniques, which is great because even for students, it's helping them with their other aspects of their academic performance. And then you also have people that are learning in the arts and working in the arts as performers, right? So they're performing on stage, whether it's in a play, a musical, cultural festivals. They are providing joy to people, right? In that aspect too. And then there's also this section of people that are utilizing the arts to facilitate people with trauma or with just, some sort of healing journey. And those folks are the ones that are looking to be more health aligned. So they may have technical skills, they may be performers themselves, but they have an interest in working with community members one-on-one. And so I would say there's a spectrum of skills and knowledge because everyone's needed, right? Everyone, it's all hands on deck with all the, challenges of the mental health crisis, the pandemic of social, isolation happening. So it's about empowering people to learn trauma-informed practices, cultural relevancy, right? But know to their boundaries and capacity what they can do and what they cannot do. So I always give an example of folks working with community members that might be going through some sort of disaster like recovery efforts, and they're engaging in arts just to help with their mental wellness, maybe as a distraction, right? But if you notice someone maybe that needs more assistance, you definitely need to refer them to like a clinical therapist, right? So there's a wide range of skills and spectrum of needs, and everyone is needed. It's just how do we now get public health workers to see that the arts are beneficial and learn some basic arts activities, right, to help people cope, and then when in doubt, refer it out. And then also, how do we get artists that are, trained really well in their craft to learn about public health, right? Maybe it's training them to be community health workers so they can actually be seen as a health worker. So that's my vision in terms of branching those two sectors together.
Yeah, and I appreciate that vision. I think it helps us to rethink, re-envision what the system is right now and how we can really set it up in a way that we have public health professionals, other community health workers, social workers, type of
Yeah.
folks that are better engaging with communities in those prevention aspects, as well as, I guess, working for the policy part as well.
Right.
But really, really, yeah, I hope that we can get closer to that vision or support more work where we are seeing arts as health and connecting that into public health in a meaningful way.
Definitely.
So switching maybe a little bit here, you manage everything from yoga classes, as we will learn a little bit later on, to social emotional arts training. What makes for an engaging, inclusive health and wellness program?
Yeah, so I've managed a lot of different types of classes, from virtual to in person. So what I think are the essential factors of managing a very inclusive program for health and wellness is, at the beginning of programs, I think it's always very important to create a brave space for folks to feel welcomed and provide them with an agenda, to serve as like a container of what to expect, right? And then obviously leave room for flexibility and when you might need to pivot. Then in the middle of a program, it's making activities accessible and giving options for people to participate, to encourage them, because people might, some people might jump all in already, and some people might be more introverted and need that, kind, gentle nudge or just options in general for them to feel like they are actually engaging. And then I think towards the end of a program, which sometimes some programs forget to do because they don't have time, however, it's really essential and important, is to make sure you have some open time, open space for reflection, really offering that space for people to, ask questions, share reflections, share testimonials, to really make it like a bookend, from end to end. And then again, any sort of like pre-post surveys are always good too as well.
No, that was very insightful and I think helpful for anyone that maybe is thinking about facilitating or just holding space for folks.
Yes.
And I guess to maybe expand on the post-survey question, like how do you evaluate arts-based health initiatives in a way that resonates with your work?
Yeah, that's a great question. So there are many channels to research, and they all contribute in some way, right? And it can be anything from clinical trials to IRB approved studies to community-based participatory research. And I think there's a lot of different, methods right now. I am part of a virtual interdisciplinary research lab for the past 3 years through the University of Florida Center for Arts and Medicine. So I've worked in different capacities in contributing to the research projects. And I've also worked with nonprofits, right, that have funders involved already. And so I think when you're working with funders, keeping in mind the evaluation, I think there's also like, what is it? Like funders want clear outcomes. And sometimes you might feel like you really need to, show the funders like their investment is worth it, right? Like their investments make a difference. But at the same time, I think for those wanting to work and highlight communities is to ensure community collaboration is mutually beneficial. And that encourages engagement within the members, and making sure that you are actually addressing their needs and not just like what funders are looking for and have it mismatched. So it's definitely like a balancing act. And mixed methods in terms of qualitative and quantitative data is really essential to research and building studies and outcomes for any sort of arts and public health interventions, prevention, and initiatives.
Yeah, and having like a proactive thought and like and a case for like what is the evaluation, what are the things that I'm trying to find out here, not only from like the funder perspective, but from the community perspective, to really get honest feedback on how you could be supporting the work better and growing the work. And before we shift to get into your academic pathway a little bit, wanted to ask you, what does public health mean to you?
Public health, to me, is about doing the best we can to live healthy lives, physically, mentally, socially, emotionally, and really about having access to the resources that we need in order to do so. I think public health, it's about learning healthy habits as well as unlearning certain behaviors that do not serve us. And I think we can only do so by really leaning into each other as a community and raising awareness.
Absolutely. And continuing on the path of, like, I guess, arts and health, you got your Bachelor's of Arts in Marketing and Music Industry Studies at San Francisco State. Mm-hmm. How did this early interest come up, and like walk us through how you thought through and what shaped your decision?
What shaped my decision on going towards a music industry?
Yeah, all of that.
All of that. Okay. Where do I start? Okay. So I've mentioned that music and dance has always been a part of my life. I was that girl that would be, making mixtapes, right, for friends. I was that girl that would be falling asleep listening to music on my Walkman. So it's been really ingrained in my upbringing too. And so I was really, I never wanted to be in front of the camera. I always wanted to be like behind the scenes, like production. So when I started college, that was kind of like my trajectory of, becoming a music producer, going on that path. And so that's what kind of led me to studying, music and music recording industry. And actually, when I started college, the first 2 years I went to a local commuter school, a Cal State school, and just did like my general studies. And then when it came time to like decide on what I wanted to actually, declare my major for, I needed to obviously find, like declare, right? And I think a lot of folks at that age, they're either like not sure what they want to do, or they think they know, and then they choose classes, and then they decide maybe that's not what they want to do. Mm-hmm. But I knew what I wanted to do. I just didn't really know how to really solidify that as like a major, because, there wasn't a lot of clear educational pathways for that. So I would say after I finished my 2 years of general studies, all the, requirements, I decided to transfer up north, which is when I went to San Francisco. And I actually discovered that some colleges have what they called a special major. It's where you would write a proposal combining coursework from 3 different colleges or departments at that campus. And then you write a proposal on, justifying why you want to mix all of these together for your career path. And it must be signed off and approved by that school. So for my Bachelor's of Arts, because my goal was to become a music producer at that time, I designed my own degree and included marketing, music in general, and then the recording industry as the third leg. So I think for me, the takeaway of just my undergrad experience in general was sometimes you have to take a risk and do more of the heavy lifting work to create a path for yourself with like unique approaches and opportunities.
That is very unique. I think in 200 and something episodes, that's probably the first time I've heard that specifically, a special major.
Yes.
But that's really cool that it allow you to craft like this degree around some of the specific interests that you had across these colleges. And one thing that like I also appreciate, and I think you said it earlier as well, is like, people think about arts and they think about the artist or the person on stage, but as you were mentioning, there are people that want to do art but not from, they want to be behind the camera or off the stage and supporting art. And I think that that's a good point to also note and just to raise up. So I appreciate you sharing that.
Yeah, of course. So I feel like, any takeaways is definitely for those looking to find a special major, just definitely do your research and see which
Mhm.
colleges offer that opportunity.
How did your early interest in music and marketing shape your thinking about health communications or engagement?
So, Omari, thank you so much for posing this question. It was really thought out. Like, I just really had to sit on it for a while and, go into some deep reflective journaling. So I really appreciate this question. Um, I think for me, because my trajectory was music taught me how people feel before it taught me how people think. So in terms of health communications, messages that ignore connecting the audience, like I think often miss the mark, right? So in public health, people don't change health behavior because of just facts and figures. They change because something resonates with them emotionally. So that I really appreciate the connection there. And then with marketing, that's taught me, how to ask, who is this for? Or what do they care about? So well-intended messages about health can fail if they are like too technical, right, or misaligned with people's lives and their lived experiences.
Absolutely love that. And I think it ties back to like the importance of public health communication and, how we have to use all the tools and skills and ways to think about how to engage with audiences, how to bring language that is accessible, inclusive, culturally, and in any other way that's possible. So I appreciate you raising that up.
Yeah.
Yeah. And then you went on to get your Master's of Public Health in Community Health Education at California State University, Northridge. What sparked that decision for you?
Yeah. So ever since I was a kid, I was a natural like educator and helper. But I was never interested in becoming a traditional classroom teacher or like a doctor or therapist. And from my work experience, I learned that I really enjoy working with communities at large. And then being always like a lifelong learner, I felt that I needed to go back to school to learn some standardized methods and concepts that will help me to advance my career and open my door and more doors for me. Um, and so, in my just talking about my MPH program in general, as an older millennial, I guess they call it a zennial, I was a bit nervous about returning back to school, right? Like I thought, how would I be able to compete,
Hmm.
and catch up with these cool kids? But then I really realized that having 20 years of work experience was really helpful while I was learning the different theories and frameworks related to public health, topics like program planning and evaluation. Whereas most of the students, my classmates, were, going from undergrad into their grad studies right away. So they were kind of like learning conceptually and hoping to apply what they learned when they actually got a job in the future. Whereas it was like the reverse for me, right? So a takeaway for me from my grad program was I would say it's never too late to go back to school. Time will pass, you know, no matter how long you wait to make that decision of going back to school. So just why not go for it? And I would say for any older adults, more mature folks going back as students, is your lived experiences and any sort of work experience you might have, any background, will serve you well. And it's all about having a growth mindset.
I definitely appreciate you raising that up. Were there any things like during your MPH program that kind of like stood out as great experiences? And before I guess you answer that, love how you're talking about like, hey, I want to become a teacher, but not in the teaching sense, in a classroom type of sense. And I think that's also something that a lot of people probably also feel in public health, like that kind of pull to want to be part of like teaching community and supporting community in that kind of way. So also appreciate you raising that up because I don't think I've like voiced that before. Okay.
Yeah, I think there's different paths, right, to what you want to do, and then just finding those unique opportunities to do so. So another thing that stood out in my MPH program is not only was a lot of the concepts I was learning, I really caught on because I was like, oh, I did that when I was working at this place,
Hmm.
right, in my previous job. So it really validated, reversely, the work that I've been doing without knowing that it was public health. And I also had the opportunity to work as a project coordinator for Cal State Northridge's Institute for Health and Wellbeing. So it's also about how do we carve out programs for college students with these different workshops that will help them with their educational performance and success, as well as their mental health and well-being. And one takeaway, I feel like a lot of, probably most and all colleges and universities have programming that are free to students, right? That it's already paid into their tuition. Um, it might be mindfulness classes, it might be dance classes, right? Or even ceramics, different workshops that will help them, relieve stress and get them to kind of refocus on their academics. And I feel like a lot of college students, they don't feel like they have permission to join those activities, even though they're on campus, they're accessible, they're free, right? They feel like maybe they have to focus on their studies more, or that's taking away from their studies. Whereas the mindset has to change, especially at a grad program too. If you're working, you have family responsibilities, right? You're probably not as connected on campus as an undergrad student. It's like, how do you carve out time and for faculty and staff to not only let students know that these workshops, they're part of their academic success and it's needed, so I think that's what stood out to me in terms of there was low enrollment in those workshops, even though they were free and accessible. And it's like, how do we, again, health education, raising awareness of how these programs can actually benefit those college students academically and overall holistic health too.
Yeah, that is a great point, and I think good work. And the I had another thought that I forgot, but I just remembered around, because one of my coworkers is also, she graduated a few years ago. She's been in the workforce a few years, and now she's going back to get her master's of public health, actually. And she's talking about exactly what you're saying, just how like the experiences and the context and the connections to work that she's had over the few years is making her just feel like all of her classmates who just came from undergrad are very immature and don't know what's going on, and don't really understand public health outside of like this theory-based
Right.
knowledge. So I definitely agree. Like, if you are someone that is thinking about doing it, then, and you really want to do it, and it's something that is going to help and support you in your career, do it. You will be bringing a wealth of knowledge, and those other students as well will also benefit from the knowledge that you bring.
Yeah, for sure.
Can you also speak about your internship with the San Bernardino County and what you learned about community and health planning?
Of course. So San Bernardino County is located in Southern California. It is known as the Inland Empire, or the IE. It is the largest county in the nation, spanning over 20,000 square miles, but it's not the most populated. So for my grad school internship, I was placed in the county's Department of Public Health's umbrella in the program called Community Vital Signs. So there are a few key takeaways that I learned from my internship there about community health planning. I learned about the MAP model, MAPP, which is the mobilizing for action and partnerships, and the collective impact approach, which involves working with community members and organizations. So part of my research, or part of my internship, I had to research and do an analysis of these methods. And so I concluded that the advantages of multi-sector work is essential because you're able to leverage experiences and knowledge and skills from people of all different sectors. And sharing of resources is really beneficial for cost effectiveness. Some of the challenges that I learned from these methods is that there are times where it may feel like there's too many cooks in the kitchen, which may, delay decisions, or anything, that needs to be prioritized may just be slowed down. And then lastly, I think it's really essential that I learned about how every county conducts community health assessments, known as the CHA, and the community health improvement plans, known as the CHIP, and how important they are in trying to find out the needs of the communities, and then how to establish those priority areas and strategies to improve those health outcomes.
So now we can talk about like your shift from corporate to community health. So you worked for years for Tom's in roles like community engagement manager and social media specialist. What did that experience teach you about building community and advocacy, and maybe like even how does that kind of show up in the work today?
Yeah, so I was one of the first 100 employees
Hmm.
for the company at Tom's.
So
Um,
how did that happen? Let's not.
oh, okay. How I would actually say going back again to networking and just building relations. So previous to Tom's, I was actually working at Disney corporate
Mhm.
in their like youth sales, youth programming, so very education event based. And my manager at that time, she had actually shifted and transitioned to working for Tom. So she was building out her role and team at Tom's. And because of our working relationships, she really wanted me to get, bring me over. And that's what happened. So I still went through the whole interview process. But I wanted to kind of really jump into like a startup because it was very startup at that time, and learn and contribute. Whereas I knew Disney was always going to be there, right? It's a large company. So I decided to take that leap and leave Disney to join Tom's, and was there for 8 years and brought over from my previous manager at Tom's. So we've had a great 10 plus year relationship of working at multiple companies together.
Well, I'm glad I asked that question.
Yeah, so for my role there at Tom's, there for 8 years in different multiple roles and different departments too. So during my time there, I learned about how a for-profit business using a social impact model can help to build community and advocacy, even though it's a business, e-commerce, right? Through that journey, I also learned a lot about global issues. And I'm really grateful to have gone to countries like El Salvador, Dominican Republic, and Honduras, where I witnessed incredible work, public health wise, of all the nonprofits, doing amazing work for their communities in those countries too. And even here in the US, I've helped to create engagement opportunities for schools and local partners for initiatives like One Day Without Shoes, World Water Day, World Sight Day. So I learned on how raising awareness of health issues can help engage communities and advocate for change.
And then what did that transition look like for you? And really cool work, by the way, and awesome story. And I think like important for people to know, like, do you work well with the people that are supervising you? You never know
Right,
where they might take you if they go somewhere or anything like
for
that.
sure.
But yeah, how did you transition from corporate wellness into like the public health field?
Yeah, I don't think there was a clear jumping point or transition. I realized that my work has always had like an indirect or direct public
Hmm.
health lens in a sense without being, actually called public health. It was always to some degree public health related and adjacent. So for me, it was more about pivoting to prioritize the public health lens in the projects and companies that I, was working for.
Love that. And I think like that is what people, especially in today's landscape of what the work is like how do you approach whatever the role is with that public health lens and try to fortify and show like how your skills and experiences really make you a strong candidate for whatever that role is. So definitely appreciate
Yeah.
you raising that up. And also were or are a yoga instructor. You've done yoga for many different organizations, and you're also a kinder music instructor. So tell us about those, and yeah, I'd love to learn more.
Yeah, thank you. Yes, yes. So I am a certified yoga instructor for adults and kids. I would have to admit that as of recently, because I've been concentrating a lot on projects of arts and health, I haven't been teaching as much, but I've taught yoga for young kids to adults. So for kids, I've taught for a nonprofit called No Limits for Deaf and Hard of Hearing Children. So in that itself, it's like, how do you even teach, deaf and hard of hearing children yoga? I would say this is a wonderful nonprofit, and the students there mostly have cochlear implants. so they can hear to some degree with those implants. And then I have a friend who created a curriculum and mat. It's kind of like Twister yoga. It's a yoga mat with different colors and different shapes to really help with body alignment. And you also learn the different yoga poses in a fun way. So, she's an entrepreneur, and she's grown her own small business in marketing and the sales of these yoga mats along with a curriculum. So I kind of utilize the platform of her program and product with these kids at No Limits. So, not only are they learning fitness, but they're also doing it in a way where they're learning shapes and colors and proper body alignment as well. And then I actually taught kinder music before I started teaching yoga. So kinder music is a international curriculum to all over the world, and it's music and movement classes to help stimulate kids, cognitive skills, physical skills, like emotional well-being. So I taught that when I was up in the Bay Area. Living up there and mostly working as an independent contractor, working with like schools, different parks and rec departments, and offering these classes to the communities there. And most of the classes were the kids along with their either parents or just guardian and an adult that they were with too as well.
Okay, that's awesome and cool that you're doing like this different work that maybe people don't envision that public health professional necessarily does. But yeah, I need to get back into my yoga. I used to do yoga like at least once a week, but it's been a while since I've done so I need to get that back onto my schedule as
Always
well.
a good reminder. Yeah, and I feel like being like having the opportunity to do this type of work, it's essential because it's part of the practice of public health, right? You're not only talking about it or writing about it, but it's actually practicing to some degree, even if it's your own practice. And then it's just another level beyond if you're extending it to teaching and practicing with others too.
Yeah, I agree with that. We need to do more of practicing public health in
Yes,
whatever way that looks like.
Put it on a t-shirt.
Okay, so before your current role, you had a role as a program manager at the Arts and Healing Initiative. How do you come across that, and what do you do in that role?
Yes. So when I was navigating my way into the arts and health field, I completed this nonprofit social emotional arts certificate program to learn about trauma-informed and culturally mindful strategies to facilitate arts-based activities. So although the instructors of the program were mostly creative arts therapists, clinically trained, we were not learning therapy. We were learning more like first aid, right? How to use arts for self-expression and coping skills. So after I completed the program, there was an opportunity to become the program manager, and I was in that role for 4 years. So again, another example of how relationship building and just being part of a community can help with different job opportunities. So in that role, I built out the curriculum onto a learning management system for online learning since it was during the pandemic. And then I would co-facilitate the classes with the instructor. So it was really important for me as the program manager and the facilitator. I have the close relationship with the students or participants of the programs who are mostly adult learners from different walks of life and different professional backgrounds. It was important for me to be in each and every one of the classes with them while the instructors kind of rotate out to have that consistency and to have that container, right? So they feel like they have someone to go to when they have questions and concerns. So it also really helped me have gone through the program as a student before I became staff too.
And you also hold a couple roles right now as chair of Arts in Public Health Community of Practice and chapter chair for Sisters in Public Health Los Angeles. So deep in the community and leadership roles. So like, tell us a little bit about those.
Yeah, for sure. I think this is definitely one example of how can people find volunteer positions to build up resume as well as networking too, and really be involved in something you're passionate about too. So currently I am the chair for an arts and public health community of practice with A2RU, which stands for the Alliance for the Arts and Research Universities. And they are housed under the University of Michigan. So it's a partnership of colleges and universities committed to transforming higher education to ensure the greatest possible institutional support for the arts. So in this group that I'm a chair for, we're focusing on building an action and research agenda for arts and public health with researchers and practitioners in higher education settings and beyond, really mapping out which programs are happening on campuses right now across the country that are, focused on students' well-being for academic and health purposes too. So that's one thing I've been doing. And then Sisters in Public Health is another nonprofit I'm a part of. I started this chapter, LA chapter, in 2024. How I got into it was I was following the org for a couple of years, and I always wanted to attend events, but I was like, there's no chapter in LA, and I want to meet people, right? So when the opportunity for an open call to establish new chapters came about, I decided to apply so that I can plan events and also create a community for LA. And for our chapter, and we have 33 chapters nationwide, and also a national chapter for those that may not have a chapter in your state or city. But basically, we have events like social networking meetups, wellness gatherings, like we did a dance class for fitness. We had a facial gua sha workshop recently. We have service events like volunteering at a food bank, and at a relief distribution for people impacted by the 2025 wildfires. And I'm also very proud that the LA chapter won Chapter of the Year in 2025. And again, I think for me, in these two volunteer leadership roles, I always thought that if I were to decide to volunteer my time, not only does it have to be something I'm passionate about, but I really hope that the org that I'm working with is, open and welcoming and organized, right? Even though they're all like growing and starting in their own ways. I have been very impressed with both organizations and really proud to be a part of the leadership and all the members as well. It's been a blast.
Well, I appreciate you sharing that, and I'm glad you also highlighted as like a way to bolster your resume as well as building a community. And shout out to Angela and Sisters in Public Health. I think that's also awesome to hear you like, hey, there aren't any events here. I want to do this. Let me build it out, and that's what we need more of. I definitely believe it's important work, and building that community is so important as well.
Definitely.
So I don't think you've seen this question, but this is a past guest question, and please feel free to take some time to answer it if you need some time. The question that they asked is, what's a book you've read in the past 5 years that has influenced your personal or professional outlook on life?
That's a very deep question. What is a book I've read in the past 5 years? I would say, well, I have a book right here I can grab and show you. I think this book for me is both personally and professionally beneficial. It came out in the last couple of years. It's called The Connection Cure by Julia Hotz. And this is basically the prescriptive power of movement, nature, art, service, and belonging. So it has vignettes about different people's personal stories. And this is also a great book to learn about social prescribing too as well. So I think, nowadays we all need more connection. We all need to find ways to, before we, go into taking meds or other, prescriptions that our traditional doctors give us, how can we really find ways to look into our own communities for different ways to express ourselves and coping, like just gain skills for coping mechanisms too. So that's one book. So thank you for the past.
Yeah, that's awesome. Thank you for sharing that. And it reminds me of a book that I read last year that I think was very impactful. It's called The Art and Science of Connection, While Social Health is the Missing Key to Living Longer, Healthier, and Happier. So I definitely have to add this book to my
Yeah,
reading list. But I think like to the point of like community connection, of being like such an important part of health that we don't talk about it, and like now expanding to things like arts and how that's an important part of health that we don't talk about enough. So I
right.
appreciate you sharing.
You're welcome.
Awesome. So moving you on to the Furious Five, the five questions that I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Public health is a very broad field, as we know. I would say my advice is to find an issue or an area of interest and then volunteer, right? This will help you figure out what you're passionate about and gain new transferable skills along the way while applying what you're learning as a student, to whatever you're volunteering for. So that's my advice.
Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
The arts and health field is still evolving, and there aren't many clear career pathways. So my advice would be to find your niche, combine your skills and interests. I call myself an accidental consultant because it would be nice to have security and stability with one employer with a full-time status. However, I've discovered that at least for now, I've been able to make a bigger impact working on multiple projects that are meaningful to me. So I would say learn as much as you can, be curious, ask questions, and network without expectations. So plant your seeds, water the soil, move the plants for proper lighting if needed, and then observe which ones grow.
Love that. Number three, what's something you're working on improving in your life right now?
I kind of mentioned it earlier, but just because we work in public health doesn't mean we are perfect at practicing what we preach, right? So, with everything going on in life right now, individually and collectively, the struggle is real. So, I have to continuously remind myself to keep up with my healthy habits.
Number four, professionally, do you recommend anything?
Oh, I would recommend, I got to plug checking out Sisters in Public Health for our events and learning opportunities. And then if you want to learn more about like the arts of health, definitely check out my website. It's just my first name, last name, jenniferkuo.com.
Awesome. And I'll link that in the show notes so people can check that out as well. And then last but not least, if there was one piece of advice you'd give to your younger self, what would that be?
So my mantra is I made a plan, I am doing the work, and I trust the process. So I would tell my younger self that if you're going to overthink things, which you will, at least do so with patience and show yourself grace. And you may be your own worst critic, but you are also your best own cheerleader.
Love that. Couldn't end it any better. Thank you, Jennifer, so much for coming on, sharing your expertise, sharing your career journey into health and the arts. I think this was very, very insightful.
Thank you so much, Mari, for having me. I really appreciate the opportunity and the time to share my experiences with all of you.
Yes, absolutely. Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a like if you have not as yet. Review it, hopefully a 5-star review, and share it with a friend who gets some value from the episode. See you all next week. Peace, everyone.
Thank you. Take care.